Welcome to today's press briefing. We have three doctors on stage. Dr. Edwin Choi, Controller of the Center for Health Protection, Dr. Zhang Shukwan, Head of Communicable Disease Branch of the Center for Health Protection, and Dr. Lau Gahin, Chief Manager of Hospital Authority. Dr. Choi will have the floor. Friends from the media, Hong Kong citizens, good afternoon. In a moment, Dr. Zhang and Dr. Lau will report to you in relation to the cases recorded today and the patients in the hospital system. Now, let me turn to our latest epidemiological investigation work. To speed up the work of investigation and contact tracing, it is essential that we get hold of the contact information of household contacts and other close contacts for implementation of isolation arrangements. Starting from 9 a.m. today, once a member of the public receives an SMS from the Center for Health Protection indicating that the test result is positive, a link will come with the SMS together with a form, so that after receiving the message with the form, the person should fill in the form and return to us via electronic means so that we can proceed to epidemiological investigation and to facilitate the triage of patients in the public hospital system so that we can, as quickly as possible, arrange for household contacts of the confirmed case to be isolated and to send the patient to the relevant facilities for treatment. As for SMS messages received by members of the public who tested positive, who are still pending admission and waiting at home, we are arranging the distribution of electronic wristbands and anti-epidemic kits with the help of logistics companies. Later this week, we will once again send them text messages with the link to the electronic forms, and with those who receive this message, return to us information of the household members so that we can implement the most suitable isolation and quarantine arrangements for them. Members of the public can also fill in this form at the platform or the website available. This is called the Public Health Infectious Disease Platform. I appeal to members of the public's understanding that we are still short of isolation and quarantine facilities. The government is striving for more such facilities to be provided. And we also need to provide isolation facilities for the high-risk patients. The Center for Health Protection will conduct epidemiological investigation and risk assessment once they get the information to arrange for patients to go into isolation and treatment facilities as quickly as possible. We'll consider the condition of patients, whether they're in stable condition and whether there are more vulnerable persons in the household, such as elderly and pregnant women and other living conditions, in order to come up with the best arrangements. We would like to reserve our isolation facilities for the higher risk individuals. For persons with a lower level of risk, they may not be able to be admitted to isolation facility or to hospital immediately. We'd like to remind those pending admission and staying at home, meanwhile, that they should continue to pay attention to their physical condition and monitor their health condition. And at the initial stage of getting a preliminary positive result or a positive result, one should be vigilant, especially for those with elderly or children at home. They should observe personal hygiene and observe hand hygiene. If their living condition permits, they should remain in their own room with the door closed, and other household members should not enter the room. And this person should also wear well-fitted surgical mask properly when leaving the room, and should avoid face-to-face contact with other household members, share a meal with them, or share other common personal items. If there is a need to share the toilet should be disinfected immediately afterwards. For persons pending admission and staying at home, 14 days after the PCR test, the person can then proceed to an RAT test with the test kit provided. And if the RAT result is negative, one is spared the isolation arrangement and one can leave home. Otherwise, the person should remain home and continue to conduct RAT on a daily basis until a negative result is obtained. To boost the vaccination among the elderly and children population, we appeal to members of the public once again. For those who have not been vaccinated, especially elderly people and children, you should get vaccinated as soon as possible so as to protect yourself and protect your family and to reduce the chance of getting a serious illness. Dr. Zhang will have the floor. The CHP and the HA, as of last night, tested 8,674 positive cases, including 3,113 cases directly reported by the HA and 5,561 confirmatory results from our public laboratory. Case numbers are from 66581 to 75054. Altogether, we received 7,090 reportable cases as of last night. Among the 5,561 cases tested positive by our public laboratory, 30 cases contained the L452R, that's Delta strain, and also 5,428 Omicron cases. There are also 96 cases with very low viral load and 7 cases with a pending case status. Among the 8,674 cases, we have 3 imported cases and the remaining being local infections. At this moment, over or around 300 residential care homes have been affected in terms of their staff and the residents inside. Over 300 staff members and over 930 residents in these care homes have been infected. As of yesterday, we recorded 153 deaths, including 90 residents living in care homes, the majority of them living in residential care homes for the elderly and some living in disabled homes. There are also 55 elderly people living in the community. 51 of them were above the age of 70 and 29 above the age of 80. 3 children passed away, including the cases earlier reported by the hospital authority. There are also 5 other cases involving persons aged 18 to 60. Some of them were chronically ill. We also analyzed the first 102 cases who had received the jabs. 7 of them received 2 jabs. The remaining cases did not receive enough jabs or did not receive any jab at all. Using 146 as a baseline, the mortality rate at this moment is about 0.3%. In the previous 4 waves of the epidemic, the cumulative mortality rate was 2.2%. As we are still in the midst of this current wave, we have analyzed the vaccination situation.
Those who have not been vaccinated, the death rate was 0.54. For those vaccinated, 0.03. So there's a difference of 18 times, meaning that vaccination is effective in preventing death. For those above age 80 who have vaccinated and who have not vaccinated, the difference is about 4 times. Previously, some of our colleagues of HA said that in the previous 4 waves, for those age 80 or above, the death rate could reach 24%. As for this wave, for those above age 60, the death rate was on the low side in comparison with previous waves. For those age 80 or above, 3.75%. Probably Omicron was weaker. We have to wait till everything has passed before we can compare. effectively. In this wave, or during this wave, there were 3 deaths among children. In comparison with previous few waves, there was none death case among children, and children were less infected. We allow children 3 or above to be vaccinated. We hope that children can be vaccinated. Parents should bring the children there, and they should try not to bring their children out. And if children feels unwell, they should be brought to the attention of medical practitioners. Just now, the controller referred to the website www.chp.gov.hk/CDPI/. So when you see this website, it is the true website. I just worry that some people may have fake websites and ask you to fill in information. So much from me now. Dr. Lau, would you please update us on the situation of HA? Good afternoon, ladies and gentlemen. We have 4,234 confirmed or preliminary confirmed patients in public hospitals. North Atlanta Infection Control Center, Infection Disease Center, Community Treatment Facility at AWE. There are about 1,600 in the Penny Bay Community Isolation Facility, and 240 odd patients isolated in the Community Isolation Facility in Chunwan, Dorset. To tell, last night, 24 patients were critical, among whom 4 had been vaccinated only. 43 patients were critical, or are critical, or serious rather. Only 15 had received jabs. As of 00 this morning, in the past 24 hours, 24 patients passed away. 16 men, 8 women, age 52 to 97. Among these 24 patients who passed away, we did some analysis. 21 patients aged above 65. Among these 21 patients, 6 had 2 vaccinations and 1 had 1 jab. The rest didn't have any information about vaccination. 15 of the 21 came from RCHEs. The remaining 3 who were a bit young, 52, 58, and 59-year-old, and only 1 had been vaccinated. Among these 3, I'll provide you with some information. The 52-year-old female patient was chronically ill, diabetes, and also kidney failure. When she was admitted, it was just because of low blood sugar. The 58-year-old patient was an inmate of an RCHE, mobile, had chronic illnesses, including liver disease, and also had stroke before. The other 59-year-old patient had diabetes. According to record from 2016, he didn't have any medical appointment since then. The blood sugar was very high. He didn't probably he didn't take any medicine because of the time lapse in data. On the 20th of February and 21st of February, 19 patients passed away, 15 men, 4 women, age 52 to 98. In the 5th wave, since now, 188 patients passed away in public hospitals. Apart from the 3 children I mentioned earlier, the majority of them were elderly people. In the past 2 years or so during the pandemic, 393 patients passed away in public hospitals. Yesterday, an additional 275 patients were discharged. The discharge rate to public hospitals, 92.5%. We are really at the limits. About 20 patients during the admission screening were identified positive. About 40 patients in the wards were regarded as close contacts. Up till now, 1,200 staff members were confirmed COVID patients. As for designated clinics, starting from tomorrow, the HA will designate 2 more clinics, and they are the Yomate Rocky Jockey Club Clinic and Changsha Wan Government Clinic. Together with the 7 earlier announced, there will also together be 9 government clinics. For those who receive positive testing results waiting for admission, if they have light symptoms such as sore throat or fever, they will be treated by these clinics. In the past week, with regard to those who consult the 7 clinics, there were about 63,000 patients. I remind the patients that they have to make appointments so as to avoid people congregating at the clinic. And the staff of these designated clinics will consider the clinical situation and provide the necessary treatments. If need be, patients can be transferred to hospitals for further treatment. As for the details of the designated clinics, the details have been given to ladies and gentlemen. And let me now turn to cooperation with private hospitals. We've been talking to private hospitals. We thank them for accepting different kinds of patients, and we'll continue to speak to the representatives of the private hospitals. And I believe the colleagues are willing to help us, and there will be further information to be announced. The floor is now open to questions. Please introduce yourself and also your organization. This lady. Good afternoon. I'm from TVB. I have a question. With regard to this wave, over 300 RCHGs have been infected, and more than 820 residents affected, 230 staff affected. The RCHGs say that they do not have adequate support, and then some elderly test positive have to be sent back to the RCHG. What kind of support can be given to them? Dr. Lau will speak on how we deal with the patients, and Dr. Chang will supplement. In the 5th wave, as for RCHGs, they are affected quite seriously because of the low in vaccination rates. The spread of Omicron is rather fast in the institutions, and there's a challenge, a big challenge for us. We hope that we can provide treatment to the infected residents as soon as possible. And we will also try to provide support on the spot. As for the residents who have been exposed but have not any onset symptoms, we hope that they can be isolated. In the first 7 days, they will be in the isolation facilities, and then in the remaining 7 days, they'll back to the RCHGs. But if there aren't adequate facilities at the RCHGs, we will provide infection control instructions, maybe even on site. We try to separate those who are not infected from those who have not been infected. As for staff members, we also provide infection control measures and suggestions so as to reduce infection.
But one challenge for us in relation to Omicron is relatively easy airborne transmission. So we want homes to be well ventilated. Some care homes are in a better condition because they are able to procure air purifiers and install them to reduce airborne transmission. Perhaps Dr. Lau can also supplement in a moment. We hope that in the community facilities, some of them can be modified so that we can provide a respite service for the residents of care homes and to provide treatment to the residents there. I'll give the floor to Dr. Lau. In relation to every patient visiting our hospital, such as the A&E unit, we would provide some checkups, such as an X-ray of the lungs or COVID-19 tests. We also would monitor the clinical condition of patients to see if the patient is required to stay in hospital for further treatment. We consider different factors in deciding whether a patient should be admitted for treatment. For example, whether oxygen therapy is needed and whether other forms of care or treatment is needed. As mentioned by the controller, we have strengthened the efforts of our outreach teams. We visit different residential care homes for the elderly to help take care of their patients and give diagnosis. We have outreach doctors and nurses. And every now and then, we also provide remote consultation services. The purpose is to step up the care home's efforts in taking care of the elderly and that they could seek advice from healthcare professionals if need be as quickly as possible. There are also other facilities that we'd like to provide to them to take better care of our elderly, such as the Infectious Disease Center and the Asia World Expo. We'd like to expand the capacity of Asia World Expo to provide treatment for elderly patients, and we also would like to deploy geriatric doctors there. In fact, last Sunday, the sports center at Choi Wing Road was just commissioned, and this is one way to take care of the elderly. Some elderly residents are in a better shape, so to speak, and they may be waiting for a negative result before they can be discharged to the residential care home, or that they in fact are ready to go back to the home, but due to some circumstances, for example, when there is an outbreak in the home or when staff members in the care home are down with COVID, they may not be able to return the home there and then, and that they could receive respite service at the center. The center is run by the Social Welfare Department, and there is a dedicated team to taking care of elderly people. It is hoped that adequate care can be provided to elderly patients at the center so as to lift the burden on the public healthcare system. I'd also like to appeal to the public here. In the past, the vaccination rate among elderly residents in care homes have been low. Before the fifth wave hit, our colleagues strived to boost the vaccination rate among elderly residents, but we understand family members of elderly residents in care homes were reluctant. They believed that the next wave had yet to hit the community and that the elderly people don't go out often. But this time, I appeal to everyone that if you have an elderly family member living in a home, please support our efforts in boosting the vaccination rate. In fact, in the past 2 weeks, many colleagues in different institutions have continued to persuade family members to agree to allowing the elderly residents to get the jab. Now, the rate is on the rise, but we need to catch up because this is exactly the critical moment of having outbreaks in the residential care homes. If we can boost the vaccination rate in these homes, it will definitely provide better protection to them. So if you have an elderly family member living in an elderly home, please support their vaccination. Next question. This one in the front row. From Now TV. The first question is this. many confirmed cases are now staying at home, and it seems you are lagging behind. Can you explain to the public clearly that in terms of the number of days for quarantine, how should one count the period? Does it start from the date when the photo of the RAT result is taken, and there is now a requirement to reply to the SMS on the household contact situation? Is it that once a case is confirmed, the household contacts should be quarantined or isolated as well? Can you explain very clearly for the benefit of the public and the employers? And you talked about the number of cases succumb to the disease and the increase in number of confirmed cases. Have there been major clusters and outbreaks in relation to a workplace or an institution? Or can you tell us which district has the most outbreaks? The third question is this. It is understood that the government plans to further tighten the social distancing measures. We'd like to have the view of the Department of Health, and for the hospital authority, are there further tightening measures? For example, experts earlier recommended a closed management system for the hospital system and for their staff to stay in a hotel instead of returning home after work. Finally, another question on discussion with private hospitals. Can you tell us more about your progress? Any update?
Thank you. Dr. Chang will speak on tracking, and Dr. Lau will speak on cooperation with the private sector. Let me speak on isolation and quarantine. Earlier on, I told you that we had 2 pamphlets for those waiting for admission into hospital or isolation facilities. Once we discovered a positive case, we immediately asked our colleagues or logistic companies sent the pack to the confirmed patients. During the waiting time, the patient will have to pay attention to the following. They have to watch out for risks of infection at home. There's a chance of infecting other family members because he or she is waiting. In this pack, we remind the confirmed patients that he or she has to pay attention to infection spreading the virus, and they have to put on fitted mask, and when they use the toilet, they have to clean up the toilet afterwards. If there are high-risk family members at home, in the past we rely on making telephone calls, and therefore we need to adopt other means. Say we adopt an electronic means. In the SMS, there is a link so that the patient can tell us the physical conditions, the conditions of family members, how many family members are living with him or her. And then we make arrangements. If he's a high-risk patient, then the hospital authority will admit the person into isolation as early as possible. If the family members have the need, then they will be admitted in other isolation facilities. Since we have adopted that, from 9 a.m. this morning until 12, we have received more than 1,000 replies through this SMS link. The future tracking and arrangements will be speeded up. As for isolation, if one is in an isolation facility or admitted to a hospital, then the person will be treated at the facility. And if within 14 days the person has not been admitted to any isolation facility, if the symptoms are mild, then he may be in a normal condition. And if he has any problem, he should use a hotline to call us or go to the A&E department or to a community clinic. And within 14 days, if he doesn't have any serious symptoms or he doesn't have any serious problem, then with a RAT, if it's negative, then that's the end of the story. There's no need for any further admission. As for those living with the patient, there is a stay-at-home arrangement, stay-home safe arrangement. The family members will have to be tested, and that is a 14-day quarantine. And within 14 days, after 14 days, if the test is negative, if the confirmed patient becomes negative, then that's the end of the quarantine. In our epidemiological, according to epidemiology, the last day of contact is the start date for quarantine. Now, the family member has to, or the patient has to stay at home. So the negative test is the yardstick. If one has to stay at home for quarantine, then quarantine date will be period will be the same as the family members' quarantine period will be the same as the confirmed patients. We've also received telephone inquiries for those who are waiting at home for their admission. On the 14th day, since he has not been to any isolation facility or any hospital, he or she may want to have some evidence to show their employers. We are making arrangements for that. During the 14 days, he or she should have been admitted to an isolation facility, but because of limited places available, he or she has not been admitted. So we want to provide some kind of documentary proof or evidence so that the citizens are able to get those documents. Please pay attention to our announcement in due course. Sorry, speakers not coming through. You refer to the PCR test positive. With the PCR test, one will receive a SMS. Is not related to the RAT. Now there are two kinds of tests. A PCR test at the center, testing center. After the test, one will receive a SMS whether it's positive or negative result. People tend to use the RAT test, the rapid antigen test that is done at home by the person himself, and after that it has to be checked again, let's say by deep throat saliva test. And after that deep throat saliva test, the PCR test, then we'll have the result, and then we send out the result, and then the date start counting from the PCR test result. Dr. Lau, we have measures for patients and colleagues to test whether the person has been infected so as to reduce the chance of further spreading the disease. For patients to be admitted, we have a screening exercise. We take PCR tests of the patients to confirm whether the patient has been infected with COVID or not when on admission. And yesterday, we have screened out 20 patients. When they came, they didn't have any, they didn't have much symptoms, but after screening, they were found to be carriers of COVID virus. As for staff members, starting from this week, every colleague on duty, in particular clinical staff members, they have to conduct RAT before the start of work. At least at that moment, the colleague is not a carrier, and that will reduce the chance of being infected without knowing, and thereby spreading the virus among colleagues. Another measure is infection control in the hospital. We impose strict measures on our staff. They have to put on their mask properly. They should avoid talking to staff members. They should avoid eating together. Everybody have to put on well-fitted masks. As for private hospitals, as I mentioned earlier, it's about this time the HA colleagues are now having a meeting with the representatives of private hospitals on ways and means of having our patients to be treated at private hospitals for, say, rehabilitation or for convalescence. whether that can be for treating dialysis or for other chronically ill patients. If they can be accepted by the private hospitals, we will have more space or more room for our patients.
Dr. Zhang will take the question on investigation. For residential care homes, over 300 homes have been affected. For the majority of them, there aren't many cases. Over 30 such homes recorded over 10 cases, including staff members and residents. And for some homes, over 40 cases have been recorded. But of course, we include RAT results as well to define them as outbreaks. In January, as we mentioned earlier, in some districts, there were more cases. In January, it was Kwaiching, accounting for 52% of the cases. For other districts, Wong Tai Sin accounted for 7%, and outlying islands as about 7%. In other districts at the time, there weren't many cases. At this stage, the cases are strewn across all 18 districts. For the three top districts, they account for slightly over 10, 11, or 12%. And the top three are Shamshui Po, Shatin, and Yunlong, ranging from 10 to 12%. In other districts, however, there are cases recorded. For the district with the least number of cases recorded, the percentage is 2 to 3%. At least several hundred cases have been recorded. So the virus is spread to all 18 districts in Hong Kong. Last night, the chief executive announced that as far as social distancing measures are concerned, on the 24th of February, we will roll out the vaccine pass scheme. This is one of the social distancing measures. As for the existing social distancing measures, they will be extended. As for lunch time requirement, there will be some adjustments together with the arrangements for arrivals. So at this moment, the social distancing measures will at least remain status quo, if not further tightened. Next question, this reporter in red. I'm from Phoenix TV. Good afternoon. Some experts have projected that after rolling out community universal testing next month, some 300,000 cases may be identified. Are we prepared for the CUT program? Are there measures to support the elderly singletons? And the chief executive also announced that restriction testing declaration operations may be stepped up before the CUT, especially during daytime. Do we have sufficient manpower? And about preliminary cases and reportable cases, what is the difference? Does it mean that reportable cases refer only to new cases recorded in the past 24 hours? Dr. Zhang will tell you more about the case types and statistics. Now, in relation to compulsory universal testing to be rolled out, many government departments will be involved, and many policy bureaus and departments are putting their heads together in terms of testing method, the collection of specimen, and partnering laboratories, our capacity on a daily basis, so as to come up with how many days we need. The next question is about the projected number of preliminary positive cases and the relevant arrangements. I would say that we are preparing for it. One important consideration is the capacity of our isolation facilities. We are continuing to strengthen our isolation facilities, and some of these facilities will be established next week or in early March. I understand that the Hong Kong University is helping us with our investigation work and the projection figures on the preliminary or positive cases in our population. So we consider all these factors. Now, you talk about implementation arrangements, for example, for elderly people living alone or multiple or different family members living under the same roof, whether they should get tested together or separately. This is another consideration. This is a very large-scale program to be rolled out. We need to take a comprehensive approach in considering these factors. Dr. Zhang will now explain the statistics. You're correct. For reportable cases, it's based on the 24-hour time period. The cutoff time is midnight. This helps us with analyzing the trend, whether the trend is upward or not. We should use the same yardstick in assessing the trend. So reportable cases include preliminary positive cases as well as positive cases within the 24-hour period. For example, for cases reported by the hospital authority, these cases would directly become positive cases. Because of this reason, for the cases reported by HA in the past, we treated it as preliminary positive cases. We've changed our approach recently. However, the figure will be included in the daily reportable cases. Our yardstick remains the same, in other words. But we did make changes to the calculation of confirmed and presumptive cases. I also talked about the cumulative presumptive cases in the past few days. For example, we accumulated some preliminary positive cases the day before yesterday and then yesterday, so on and so forth. And then we have the cumulative preliminary positive case figure, which doesn't reflect the trend. It only reflects, for example, our workload or the fact that some specimens have not been delivered to our laboratory for a confirmatory positive result. So having considered these figures, we believe quoting the daily reportable cases will better reflect the trend. Like Dr. Zhang said yesterday, we had 7,990 reportable cases. Whether they are presumptive cases or confirmed cases, by the time we receive the report, our work hasn't changed. Once we receive a case report, we will proceed to isolation and quarantine arrangement, and this has always been our approach. When we receive a presumptive case report, we would start the relevant procedures. In the past, in a day or two, we will be able to confirm a preliminary positive result. In terms of our epidemiological investigation or other arrangements, our procedure would start right away. Next, an English question.
In the SCMP, the city has imposed the toughest social distancing measures yet, and we have also seen the highest vaccination rate since the start of the pandemic. But this has not stopped the spread of the virus, with another record daily caseload announced today. When can we expect to see an impact, and how long will it take to get things under control again? Also, it's expected that people doing outdoor exercise and in country parks will have to wear masks again. So how has the science on this suddenly changed, and why are we being required to do that again? And with universal testing starting next month, how can people avoid getting infected as they wait for their turn to get screened? And I'd also like to clarify some things. So have there been any more people who tested positive in the morgue or died outside public hospitals? And can I confirm with Dr. Lau the total number of HA staff infected since the fifth wave began? Thank you.
Okay, so I'll respond to a question about the current control strategies and also the universal testing. So yes, indeed, we are in place series of social distancing measures, and at present we are also trying to boost up the vaccination rate in Hong Kong, so that to try to contain the disease. And at present, the spread in Hong Kong is still severe, and we think that we may wait for a few weeks to see whether the current measures and also the vaccination will help to slow down the spread of the disease. And for the requirements of wearing masks in the outdoor activities, so indeed, when there is crowded areas like outdoors, there's still a chance of disease transmission, especially for the Omicron, which is quite airborne, especially the short-range airborne transmissions. So with wearing a mask, especially a well-fitted tight mask, will help to prevent the spread of the disease even in the outdoor activities. So for the universal testing arrangement, there are many bureaus and departments are still figuring out the whole strategies and the protocols for this testing, which is quite a large scale of testing and operation in Hong Kong. So indeed, we would take very careful consideration about the infections control during the testing arrangements, like we did before for many restriction testing notice and also the compulsory testing in different estates and places. So I'll leave Dr. Lau to respond to the hospital authority part.
Okay, up to this moment, around 1,200 hospital authority staff confirmed to be having COVID-19 disease.
No additional deaths outside public hospitals?
Sorry?
Are there any additional deaths outside public hospitals?
Okay, so Lau.
I just got the figure who died in public hospital.
Okay.
So.
問多條英文問題啊，後面嗰位。
One more English question, please. The one at the back.
Hi, CNN. In recent days, there's been a couple of cases where very young children have been separated from their parents, children who have tested positive for COVID and whose parents are still testing negative. I wanted to ask, why can't parents be with their sick and vulnerable children during treatment? How many infected babies and children are currently separated from their parents because of COVID-19? And how old is the youngest child? Do you think the threat of family separations might actually prevent families from bringing in their children when they are sick to the hospital? And finally, with universal testing happening in early March, we're definitely going to find out about a lot more positive young children. So does the government have capacity and resources to keep families together at that time? Thank you.
Okay, so thank you. So I think I will let Dr. Lau to respond to the hospital admission part, because I think we definitely know that if we can, we have to allow the parents to take with the children, especially sick children, not leaving them alone in the hospital. Yeah. So I'll let Dr. Lau to respond to the current measures and also the protocols of handling infected children. Okay. So for the universal testing part, yeah, this is one of the considerations we have to bear in mind, because of the for these operations, we think there would be quite a number of positive cases arising from these operations. And if there is children or even live alone adults, so we have to take care of them after the testing. So this is one of the another major considerations arising from these major testing operations, which we have to handle quite 1,000 or 10,000 of cases, yeah, in a very short period of time. So Dr. please.
Currently, we will try to allow the parents to take care of the sick children in the ward setting. However, due to the limitations of the isolation facilities, as well as we worry about the infection control measures, some children may be taken care in the pediatric isolation facilities, which is like the other sick children. They are taken care by our professional staff, including the nurses, the doctor. Yes, we will case by case. We talk to the parents to see whether we can allow more visiting, for example, by the video conferencing or by other means that improve the communication between the children and the parents.
下一題，前
Next question, the one in the front, lady in the front. Good afternoon, doctors. I'm from Mingpao. I have a question for the HA. Some medical staff told us that some internal wards without negative pressure facilities accepted the patients. Certain screens were put up, or the nursing stations were provided with screens only. Is there such a situation? is it adequate in terms of preventing cross-infection and in terms of adequate infection control? Will the CHP continue to investigate on infection among drivers of the government drivers and also drivers of the LegCo? How many drivers have been infected? Now, you have provided a more data analysis. This morning, Dr. Ho also asked for the disclosure of age and also gender distribution, and whether and also patients that require oxygen supply. Will you provide similar figures just like those in Singapore? On the 19th of February at 3, that was the latest update. Why haven't you updated the addresses? I'll ask Dr. Lau to speak on the HA's view, and then Dr. Chang will speak on the outbreaks of some cases. Now, the situation is serious. Many patients were confirmed, and they are waiting for isolation facilities. Some patients have symptoms. They have to be treated in the hospital. The facilities that can be used to accept COVID patients reach 90-odd%. In the past, that wasn't so high. Now it's more than 90%. That means it has far exceeded the capacity of accepting new COVID patients. In the second or third waves, we had secondary isolation facilities for those who were rehabilitating. But for this time, the outbreak was rapid, and there are too many patients waiting to be admitted. We have to accept patients in our internal medicine ward, but in wards. In fact, we have also used orthopedic wards and other wards to surgery wards to accept or to admit patients. We have infection control experts to assess the situation and propose advice on reducing infection risks. The design, the ventilation, rate of exchange of air, PPE, PPE by our staff members, masks for our patients, etc. are all the measures and factors we have to consider. And we put everything together so as to minimize infection as far as possible. If you compare that with negative pressure wards, that is not comparing like with like. Not for this time, at least. The number of confirmed cases is so high that a certain number of patients have to be admitted to the hospital. And we need to balance the admission rate and also infection control measures. As for the COVID-19 virus, in particular, Omicron is very infectious. You can imagine that in any situation without masks, or in any situation with long exposure, even with masks, there's chance of infection. Say when you are talking, having removed your mask, or when you are eating together, having mask removed, that there is infection. And in some buildings, there is also the spread. There is airborne spreading. And there's a need to conduct thorough cleaning, if at all possible. Try to allow your staff members to work from home. The places commonly used should be reduced as far as possible, and try not to remove your mask as far as possible. Concerning the analysis of the cases, we try to obtain all the data available and then release information to you. As for Omicron, the spread has never been experienced before. It's so fast. The cases surges from 100 or 200 cases per day to today or more than 7,000 cases. If we are to conduct a quick analysis, we still need time. Dr. Chang's team and Dr. Lau's team have been trying their best to provide the analysis for you as soon as possible. As to whether we can provide more information, more analysis to make it more transparent, to make it more transparent to the public, we try our best. As for isolation at home, we need to make telephone calls, so that is some time lapse. But judging from the reply of the citizens, we believe that we can obtain the information, necessary information very soon, and then we can update the information quickly. 2 more questions, please.
I'm from Hong Kong 01. Good afternoon. My question is this. For the elderly respite centers, how many elderly residents have been sent there? What is the situation? And will you consider operating a couple of more such centers? For the 24 patients who met their demise, which jab did they receive? Were they Omicron or Delta cases? Can we have more details in relation to these death cases? And about this link to an electronic form, we tried to access it. And it seems that many of us couldn't access the link. Would you improve the system? And if elderly people are not familiar with using mobile phones, can they use the conventional means? I'll defer to the other 2 doctors to explain about the depths. About the electronic form, we do envisage some users not being able to use electronic forms. If on checking we find no information contained in the electronic form, we will ring them and follow up. Sometimes we need to ask follow-up questions as well. We need to go deeper in our investigation. For example, because of the patient's occupation, we need to make further inquiries. And I thank you for your reminder. We're not sure about the network situation. And around noon, when I left my office, I learned that there are over 1,000 cases, and perhaps I'll pass the problem to Dr. Zhang. Maybe too many people are trying to access the platform at the same time. As of last night, for Chai Wing Road Sports Center, about 100 elderly people had been sent to the center via our clusters for further care and treatment. For the 24 patients who passed away, as mentioned just now, 7 patients received 1 jab or at least 1 jab of COVID vaccine. But I'm sorry to say I don't have information at hand about exactly which vaccine they received. In other words, 2/3 of the patients who passed away did not receive any jab at all, at least from the information I have at hand. In other words, 2/3 of these patients who passed away were more vulnerable as they did not receive any jab, and they tended to have more complications and even deaths. This is also consistent with the global evidence that once vaccinated, the risk of further complications or death would be substantially reduced. So I echo Dr. Choi's appeal for residents living in care homes. And let me cite these cases for the patients in their 50s who passed away. They had mobility issues and they resided in a care home. So for staff members and residents living in care homes, I appeal to you to get vaccinated as soon as possible. I understand family members may have their concern because of the old age of the residents. They may be concerned about the side effects, but we understand from evidence around the world that if you get vaccinated, you'll be safer. Whereas if you are left unvaccinated, you'll be exposed to greater COVID risks. Last question, this lady over here. 3 doctors, good afternoon. I'm from Economic Times. I have a question about residential care homes. I received information that for elderly residents who are under isolation at the moment, they have a negative test, but then they feel unwell and they get admitted, and then their result becomes positive. From the residential care homes perspective, because they are not healthcare professionals and because of manpower concerns, they may have problems with tackling these cases. Now, with so many homes with deaths, had these cases been detected, some deaths could have been avoided. And about confirmed cases who have stayed home 14 days. If they get a negative result after 14 days, they can leave home. But what if it's an RAT test that they perform on their own? What is the proof that would allow them to go out again? Dr. Zhang, I understand that you announced preliminary positive figures in relation to a few days before. Would you also announce the preliminary positive cases recorded today? And Dr. Lau, you mentioned 19 deaths between the 20th and 21st of February. Can we have the breakdown? How many on the 20th and how many on the 21st? About the 2 additional designated clinics, the 2 clinics are in Sham Shui Po and Cheung Sha Wan, both in Kowloon. Is it because the situation is more dire in Kowloon? What about other places in Hong Kong? Will there be additional designated clinics? I'll defer to Dr. Zhang and Dr. Lau to respond to your questions first. I've been explaining that the presumptive cases is a cumulative figure, which I do not want to use in assessing the trend. I can tell you, as of last night, the cumulative number of preliminary positive cases is 8,566. I'd like to, however, quote the reportable cases instead in assessing the trend, because otherwise, if we use the cumulative figure, it may be affected by, say, the delay in receiving some specimens. For example, as of last night, the preliminary positive cases, the cumulative figure includes 2,000 cases reported just last night, but it also includes some cases reported the day before last night and 2 days ago. So that's not a figure to help us with identifying the trend. I'm not going to quote this figure anymore. I'm not trying to conceal the figure. I just don't want the public to be misled in the sense that this figure represents in any way the trend. Dr. Lau. 1 patient, aged 89, passed away on the 20th. The other 18 patients passed away on the 21st. Something about their age. 2 patients were below 60 years old. The others were all above 60 years old. 13 patients were above 80 years old. So elderly or old age is one high-risk factor for infected patients, leading to more complications and mortality. One aged 52 and the other aged 56. I'd like to talk about these 2 patients again. For the 52-year-old patient, this patient was residing in a home. He was disabled with some illnesses. And for the other patient, aged 56, the patient was on long-term medication, probably because of some chronic illnesses. For the question about designated clinics, starting from the 16th in the past week, we received 6,300 patients in the 7 designated clinics across the territory. That means on a daily basis, we offer about 1,000 tickets for the COVID positive patients with mild symptoms for consultation. Yes, indeed, there is a demand, but I would say that we have patients all across the territory. In considering commissioning designated clinics, we consider a number of factors such as demand as well as the conditions of the GOPCs. After all, these are confirmed patients, and if the clinic is too small in size, it will not be suitable. We need to choose larger ones with better ventilation, etc. So there are a number of things to consider. Every day we keep watch of the figures, such as the number of patients received and the number of bookings, in coming up with the best arrangements. Such as on this occasion, in fact, we increase the number of designated clinics from 2 to 9 just in a week to cope with the demand. Let me take your question on home confinees or confirmed cases waiting at home. Now, after receiving an SMS message indicating a positive result, this will be the start of the counting of the days. Now, some of them may be waiting to be admitted depending on their living condition. And then the resources have to be set aside for the high-risk individuals, so some may be subject to home isolation instead. For the Omicron variant, the incubation period tends to be shorter. So after 14 days, if this confirmed patient seems recovered, it is very possible that he would get a negative test result. But we still require a PCR negative test. Once there is a negative test result, the resources can be reserved for those in need. Now, for the positive cases who have stayed home for 14 days, like I explained just now, they may need proof that they have been subject to isolation under some circumstances. And like I said, arrangements would be made in due course because, like I said, if these patients have been sent to an isolation facility or a hospital, at the time of the discharge, a medical record or a certificate will be issued. But for those who stayed home whilst under isolation, we will work out an arrangement so that the home confinees can report their condition to the companies concerned. We want to save the hassle for the general public to in relation to the report. We believe after 14 days, the risk of infection would be very low, together with the home test arrangement. And I thank the reporter once again for informing us about the slow connection of our platform. Dr. Zhang's team will fix the problem as quickly as possible. Now, if the connection remains slow and if you cannot access the platform, please be patient. After an hour, go back to the platform and fill in the information for our benefit. We really rely on this website to get information from you. So we will dispatch a team to fix it as quickly as possible and speed up the connection. And if after an hour the connection remains slow, please allow us some more time. This is the first day of commissioning, and maybe many people are trying to fill in forms for us. Please give us more time. That's the end of the press briefing.